This is the front of the heart. See, this is atria, ventricle, ventricle. Open it up. This ventricle has thick muscle, so it's the left. This one is thin muscle, so it's the right. So close the heart again. This is the right ventricle. So this is the left ventricle, left atrium. I'm going to have to use two hearts to show everything. So this is the atria on the left ventricle. So this is an AV valve. It's called the mitral valve. Then you have the chordae tendineae, interventricular septum between the right and left ventricle. The other valves, the semilunar valves, are hard to see. This wasn't the heart that has a good one. No. Papillary muscle, really prominent on this half. This would be again the left atrium because this is the left ventricle. Right here is the pulmonary trunk. So the blood exits the right ventricle
through the pulmonary trunk.
And goes to the lungs. Back. This is the back of the heart. I stick my probe in this. Remember, I said this is the left side of the heart and this is the right. So this is still the right. And this is the right atrium, which receives blood from the vena cava. So my probe is in the superior vena cava. And it's dumping blood into the right atrium. There's one of these that had a good semilunar valve on it. It's snowing?
No, it's not that cold.
My hands are. Here's the good one. Okay, this is a different heart. So, this is an AV valve. This is the left ventricle, so this is the mitral valve, AV valve between the atria and the ventricle. And here's a good view of a semilunar valve. You can see the leaflet. See how baggy it is? That's a semilunar valve. Blood exits the heart. And this is a sheep heart, so there's two exits instead of one. And it's exiting, again, this is the left side. The left ventricle, the blood leaves the left ventricle, goes out the aortic semilunar valve, that's this one, through the aorta, which in the sheep, the way it's cut, there's two holes here. They're both aorta.
So what?
See, that's the. What's that?
You have two holes, so does it like a 50-50 chance, which just goes out one of them? Or are those?
It's just the branching.
Oh, them are the branching.
We have branching in us,
subclavian.
But the cut. And a sheep, the branching so soon that when they cut, you see a branch.
I see.
But in a human, it would be like this pulmonary trunk looks with one lumen. So those are the main things. This one's good for the semilunar and the aorta. And this, like you said before when you picked it out, this other heart is good for the AV valves and the ventricles, right versus left, and the thickness of the wall. And the superior vena cava is also in this heart and that heart. She didn't say what? They're talking about Dugan. So those are the main things for the sheep heart.
Not a problem. Valves, chambers,
blood flow.
Blood flow, that's it.
Everything about it. What about the layers? Epicardium,
No,
pericardium?
no, don't worry about that.
Okay. Endocardium.
I say we didn't do base or
Ew.
apex,
Base or
nothing.
apex.
What did that come out when I
Yeah.
pushed my probe through?
Hey.
That's fat from the kitty.
Yeah.
Oh,
you don't
from the
mind.
cat.
Where's the or the superior vena cava?
I did that one already. Just
I
hit
didn't see it,
rewind.
sorry. Ah,
Hit rewind.
Oh.
What heart was
I
good.
didn't hear it.
I don't think this was the good one. There's one that was really good. I think it was this one. You can feel the probe. It's in this chamber, which is called a right atrium. The blood dumps into the right atrium from the superior and inferior vena cava. And I don't see the inferior vena cava on any of these. I don't think I did. No, but you saw the superior one. Wait a minute. That's fat. That's fat. Yeah. Someone, did you need help?
No, I was just watching.
Oh. Okay, so you're gonna email that so I can see how it looks? And then put it on the Nike site now so my other lab can see it?
It's that one.
Because I don't want to get the heart back out again.